Hello, welcome to the 2025 Statewide Immunization Training. This module will be specific to the New Mexico Immunization Registry, otherwise known as NMSIIS. My name is Catherine Cruz, and I'm the NMSIIS manager for New Mexico. The New Mexico Statewide Immunization Information System, otherwise known as NMSIIS, is the immunization registry for the entire state of New Mexico. It currently houses over 3 million patient records, over 40 million individual vaccination records for those patients, has over 1,500 immunization providers in New Mexico, and nearly 25,000 active users that utilize the system. We're very lucky in New Mexico that NMSIIS is a consolidated system that includes centralized immunization records, inventory management, report capabilities, outbreak response, staff and clinic changes, and more. We're also very lucky that we have a state law in New Mexico that mandates reporting for all vaccine doses that were administered. This law is called Senate Bill 58 and was implemented in 2013. It requires that all administered doses in the state, regardless of vaccine type or patient age, are reported to NMSIIS. This includes influenza doses, doses administered to employees, doses administered to adults, all vaccine types, and all ages. The only exemptions to this mandated reporting would be federal entities such as the Veterans Health Association, VHA, or the Indian Health Services entity, IHS. And again, it's very beneficial that these federal entities do voluntarily report data to NMSIIS, which helps our system to be as complete and accurate as possible. In New Mexico, we have a public consumer portal, which allows parents and guardians to look up immunization records online and save them digitally, which eliminates the need to carry the multiple age documents, such as a vaccine passport or a yellow card. The system is web-based and is mobile-friendly, so you can use it on your tablet, on your phone, on your computer, anywhere you have the internet. And the way that it works is you would enter the information into the portal. You would need to enter the first legal name, the last name, the date of birth, and the gender. An exact one-to-one match is required, so whatever is entered into the portal must match what is in NMSIIS, which is why it's so important to use legal names. Once that data is entered, if it is a successful match, the requester will receive an authentication code via text message or email that will just verify the identity of the requester. This is to prevent phishing, to make sure that nobody can access records that aren't their own records or their children's. If the match is unsuccessful, please contact our help desk or reach out to your primary care provider, and we can update that information in NMSIIS to be sure that the public consumer portal does work for you in the future. The portal is available in English and Spanish, and we have recently changed the URL. It was previously VaxView.doh.nm.gov, and unfortunately, due to an administrative error, that URL was purchased out from under us, and so we had to update it to VaxView.doh.nm.gov. We do have lots of promotional materials. We have incentive items, business cards, flyers, posters that have this new URL on it. Please contact me or our program if you are interested in some of those promotional items for your clinic. I'm going to go ahead and show a quick demo of the system. Here's the website itself, VaxView.doh.nm.gov. Here on the top left, you can see the opportunity to toggle between English and Spanish. And then further down, you can choose to either search for your own immunization record or for that of your dependents. A little bit lower, you can see the entire process, entering the information, identity verification, and viewing the immunizations. In this case, I am going to look for myself as a test patient. Takes you to this next screen, and at this point you can still change the language and you can still change if it's for yourself or a dependent. Again, just a reminder to please use legal names. Using a nickname will result in an unsuccessful search. Just going to go ahead and enter first name, last name, date of birth, and gender. At this point, you also need to verify your identity, again through phone number or email. I do recommend phone number, as emails can sometimes take longer or the verification code can be stuck in a spam or a filter folder. so mobile text is just a little easier. I'll go ahead and enter that to get my access code. In this case, I was successful, and so it is asking me to enter my verification code that I received by text message. If I was unsuccessful, I would have received a message that said so and indicated the next steps. Please keep in mind that if you submit an unsuccessful search 3 times from the same IP address, the system will lock you out for 30 minutes. And again, that's a security measure just to prevent phishing. In this case, I'm going to verify my code that I received. And at this point, it brings me to the immunization record of this patient, which in this case is Mickey Mouse. The immunizations are grouped by vaccine type. You can see the dose numbers, you can see the date that it was given, and the age of the patient at vaccination. You can scroll down to see the entire record. Up at the top, there's several boxes. If I wanted to download the full record, it would download it in a PDF format that I could then save, print, email, upload, whatever I needed. You can also download a COVID-19 record. This is similar to the COVID-19 cards that were handed out during the pandemic, except this is an electronic format. And then we also have an opportunity to pull a COVID-19 QR code. These were really important during the pandemic for vaccine verification purposes, if you were traveling or needed it for employment to prove vaccination status. Keep in mind, after 20 minutes of inactivity, this page will go back to the home page and you will have to search again. Now, we mentioned earlier that there is a mandating reporting law in place for New Mexico that says that all administered vaccines must be reported to NMSIIS, regardless of vaccine type or patient age. There are 2 ways for healthcare providers or vaccinating providers to report to NMSIIS. The first would be manual entry, in which case the healthcare provider would log into NMSIIS using their own credentials. Please don't ever share NMSIIS login credentials. They would log into NMSIIS, search for the patient, and then update the patient demographic or vaccination information manually. The other way is via automated data exchange. In this case, the healthcare provider would enter data into their electronic health record system or their EHR, and then that system would cross to NMSIIS in an automated data exchange process. We do not usually allow NMSIIS users to have both manual entry and automated data exchange access. And the reason for that is if they're entering manually and then it also comes through via the EHR, chances are that the data quality will not be good and that the likelihood of it being duplicated will be much higher. Now, data exchange itself is really beneficial as that data crosses over nearly immediately, and it means that the provider really only has to enter data into the one system. If you are interested in becoming a data exchange provider, please contact Marlene Pena. Her email is here on the bottom of the screen. She is our NMSIIS data exchange coordinator. What she will do is give you some initial information, and then she'll work with your EHR vendor to set up testing credentials. Testing will be conducted to ensure that the format of the messages is correct for all the data to cross over successfully, and then you'll be moved into production. If your location is already set up with data exchange, but it's not working properly for one way or another, please notify us right away. We have 4 people on our NMSIIS team, and only one of them, Marlene, is our data exchange coordinator and data exchange expert. So it's really difficult for her to monitor all 1,500 providers. So if you do have an issue with your data exchange, it's not working properly, the connection is wrong, the credentials need to be updated, your EMR vendor has questions, please notify us right away. We can definitely work with you on troubleshooting and doing additional testing or setup to ensure that that connection is restored. Additionally, please contact us if you're switching EMR vendors. If you are currently with Epic, but you are moving to Athena or NextGen, please notify Marlene or call our help desk. Again, we only have the one staff member that is monitoring, and so it's really important that you provide us with as much information as you can. A couple other reminders. Inventory in NMSIIS does not auto-decrement for data exchange providers. If you are a manual entry provider and you log into the system and you administer doses for a patient, you document them on the patient's immunization record, those doses will automatically pull from your inventory. But if you are a data exchange provider, that is not the case. The doses will not automatically pull from your inventory. When you go to do your reconciliation each month, you will need to document how many doses you've administered and how many doses you've had on hand. The system won't do it for you. So just keep that in mind. That is something we're looking into as a future project, but it hasn't occurred yet. Keep in mind, additionally, that data exchange provider facilities cannot manually enter data into NMSIIS. Like I said, we try not to allow access to both, just for data quality issues and duplication. And if a patient comes into your clinic and they are not receiving a vaccine, but you realize that their date of birth is wrong, or you need to update their address or their phone number or their last name, that data will not transfer to NMSIIS without an administered dose being documented. So what you'll need to do is contact our help desk or contact our NMSIIS access email and let us know of those demographic changes, and we can go ahead and make those for you. But if you just enter them into the EHR and submit them, those demographic changes will not cross without an administered dose. Which brings us to the importance of data quality. Like any data system, NMSIIS is no different. Our registry is only as good as the data that the users put into it. We mentioned that we have nearly 25,000 users in the system. That's 25,000 people who have the ability to view or edit data in NMSIIS. And we all have the responsibility to make sure that that data is as high quality as we can. This includes completeness, validity, timeliness, and accuracy. We report at both the state and federal level for coverage rates, from anything from pediatric immunization rates to adult coverage rates to specific outbreak instances such as measles. We report those at the state level and at the federal level, and it's really important that we have those numbers as accurate as possible, especially as they usually dictate where we need to create more outreach efforts or where we need to focus on vulnerable or unvaccinated populations. The first data quality measure that I'd like to mention is timeliness. We talked about Senate Bill 58 that requires mandated reporting. In addition to just reporting the doses, it does have specifications that the routine vaccines, which now include COVID-19, must be reported to us within 10 days. So if a dose is administered on a Friday, 10 days after that, it must be in NMSIIS. If a location is data exchange, more than likely it's going to cross over that same day, which is why data exchange is really useful. It ensures that timely and accurate reporting. If you conduct a mass event, let's say a University of New Mexico is holding an influenza clinic and they vaccinate 500 people, that event would have 30 days to report those doses to NMSIIS. Just because we know that not everybody has the staff, time, or resources to get those doses reported that quickly. The next data quality measure to focus on is validity. We want to make sure that all of the data is accurate and that it makes sense. If a patient is born in 1980 but receives a vaccination in 1975, according to the system, that doesn't make sense. We want to make sure that we're paying attention to expiration dates, administered dates, dates of birth. We want to look at lot numbers and vaccine types for specific age groups. We want to make sure that all of the data makes sense. It's really difficult when patients or when providers enter data as generic data, such as 1900, if they don't know the year of birth, because that's not possible and it's not going to be likely for our system, which makes that information unusable. And then the third data quality measure would be completeness. We want to make sure that all fields in NMSIIS for both patient information and vaccination information are complete. Very commonly, we are missing mailing and physical addresses. Race and ethnicity were recently identified as required fields during COVID. We know that a lot of patients don't want to provide that information. There is an unknown option, but anytime you can, please capture race and ethnicity. Again, that helps us to know which populations are under-vaccinated or need more outreach efforts. We also want to make sure that we're obtaining phone numbers and email addresses. During the demo of the consumer portal, you saw how important it was to verify the identity of the requester, and if the phone number is outdated or missing, then there's no way to make that match, and therefore they won't be able to access their immunization information. Please notify us for any data quality issues in NMSIIS. It might just be a quick phone call or a quick email to let us know that a name is misspelled or a date of birth does not match or an address needs to be updated. It might seem like additional effort, but really that one email and us taking 3 seconds to make that change will improve the quality of our data. And if all 1,500 providers and all 25,000 users make this effort, our data really can be the best possible. We always follow CDC and federal data quality guidelines. We take a look at our data at rest and analyze the existing data to try to improve it as much as possible. We utilize address validation through a program called SMARTY. And what this does is it compares addresses entered into NMSIIS to USPS addresses to make sure that they are correct. We also use automated patient matching and deduplicating jobs to try to limit the likelihood of a duplicate patient or duplicate vaccine. And then we exchange data with systems such as vital records bureaus. We receive birth and death data on a daily basis, which helps us to ensure that NMSIIS is as accurate as possible. A few years ago, New Mexico began participating in a program called IZ Gateway. This was kind of new during the pandemic, and what it does is it allows us to exchange data interjurisdictionally, which means with other states and other territories. You can see on the screen all of the green states are the ones that New Mexico currently exchanges data with, and what that means is that we can query their registries and they can query ours. So if we have a student that comes to New Mexico from Colorado and the parent doesn't have their physical immunization records, NMSIIS will query the Colorado registry to find that student and to pull their immunization record into NMSIIS. This really reduces the impact on school nurses, school administrators, and healthcare providers. You'll notice that we are connected with jurisdictions all the way on the East Coast, such as Delaware. And the reason for that is because there are New Mexicans there. And if those jurisdictions are willing to connect with us, we are willing to connect with them. You'll notice that Texas is yellow, and the reason for that is that Texas has a state law that they are not allowed to share data with other jurisdictions, which is unfortunate for us because we know there's a lot of back and forth across the New Mexico and Texas border, but in that same respect, we still choose to share data with them. So we know if New Mexicans go to Texas, we want to make sure that they have an updated immunization record and access to it. Now, Arizona on the left-hand side is gray because they are not fully onboarded to the IZ Gateway yet, but as soon as they're onboarded and able to start exchanging data, New Mexico is in the queue to match with them. So that is upcoming in the next year. New Mexico is also connected with the federal VHA system, the Veterans Health Administration system. What this does is allow us to bring in data from the VHA system, specifically adult data, which has really helped the completeness of New Mexico's adult coverage rates. Now, NMSIIS has a wide variety of reports and resources available in the reports module. That page can be a little overwhelming just because of the sheer volume of links provided. I would encourage all of our NMSIIS users to utilize the Control F functionality, which is find. And let's say you are looking for patients with active exemptions, you can do Control F, type in exemptions, and it will take you to the right report that you're looking for. We have a whole section on provider reports, specifically those that give information for your existing inventory, patient detail with services, which helps us with reconciliations to see doses administered, patient reminder recall to see those due or coming due for vaccinations. We have school reports that provide vaccination status or exemption status, coverage rates specific to schools, And then we also have what's called a Reports Quick Reference Guide. And this is a little misleading because it is not quick. It is over 200 pages. But again, use that Control F functionality. This guide will tell you every single report in NMSIIS, what it does, how to run it, what the screenshots look for, and it's really, really useful. If you're looking for a report that you don't have access to, please let us know. And if you're looking for a report and you're not sure how to run it or you need a little bit of guidance, please reach out to our help desk. Now, these are just some quick coverage rates for New Mexico. This is from 2018 to 2024. This specific chart looks at the pediatric vaccination rate. So for the 431, 3314 series, this chart is for kindergartners in New Mexico, and you can see there's an increasing trend across the board from 2018 to now. You can see individually a similar trend line for nearly all vaccination types outside of maybe our pneumococcal and our 7 series overall. This chart is very similar, but it's for 6 to 11-year-olds. Again, looking at the 431, 3314 series has a similar trend line. You can see that the PCV in the 7 series as a whole is lower than the others. MMR and varicella at the top of these charts. This chart again is very similar, but it's for the 12 to 17-year-olds. Same vac series, same time rate. Kind of a larger jump right before and around the pandemic, but a similar trend line to the others. This one here is the coverage rates for adults by age group. Same timeline. The blue line at the top is 65 and older, and the orange line under it is for 18 to 64-year-olds. We know that we tend to have higher uptake for our older populations, as a lot of our older populations maybe have underlying conditions. And honestly, most of them remember infectious diseases and maybe have been exposed to outbreaks over their lifetime that some of our younger generations haven't had to experience. This one is for pneumococcal vaccine coverage rates for 65-year-old adults. Very slight increasing trend, but increasing nonetheless. And then this is for our shingles vaccine coverage rates for our 50-year-olds and older. You can see there's a dip there around 2020. We know that there was some vaccine hesitancy and some overload of vaccine information around the pandemic and after the pandemic, so you can see that here. Now this vaccination data is for vaccine exemptions in New Mexico. Overall, the bottom line is that vaccine exemptions for students are increasing every year. On the chart on the left, you can see that there was a sharp decline in 2020 to 2021 school year. We know that's because students were doing school from home, and that remote school led to less compliance and less oversight with the process for vaccine exemptions. But since then, vaccine exemptions have steadily increased. Last year, getting to an all-time high of over 5,500. We are on trend for the 2024-2025 school year to be even more than that. On the right-hand side, you can see a similar chart with the same trend line, except these would be the vaccine exemption rates in New Mexico. You might think that our ending rate of 1.19% is not all that high, but keep in mind that's nearly 6,000 students, and that's not proportionate across the schools. So some of our schools might have much higher vaccine exemption rates than others. A little bit more exemption data. On the left side, you can see our school exemptions by type. We have 2 types of vaccine exemptions in New Mexico. Oh, what happened? Apologies, let me get that back up. Okay. We have 2 types of vaccine exemptions in New Mexico. The first one is religious, and the second is medical. Religious exemptions make up for more than 95% of our vaccine exemption types. And medical exemptions are less than 5%, so they're a much smaller sliver there. You can see the orange part of that pie graph. On the right-hand side, you can see the exemption frequency by vaccination exemption type. The top is religious exemptions, which has a very similar trend line to the overall vaccine exemption trends. And the bottom one is for medical exemption frequency. There has been a sharp decline over the last few years in medical exemption frequency, and I'm not positive that that's really that medical exemption need has gone down, but I think that parents and guardians have realized that it's a bit easier to obtain a religious exemption in that they only need to write in on the form that vaccines are against their religious beliefs, rather than obtaining an affidavit or a document from a medical provider each year. So I think that might explain some of that decline. This here shows exemption rate trends in New Mexico by county. You can see the darker counties, DeBaca, Lincoln, Santa Fe, Taos, have the higher exemption rates, whereas the lighter ones, McKinley, San Miguel, Socorro, have the lower exemption rates. And then speaking of exemptions, we do have a new exemption form this year. It is the 2025 version. So when a parent or a guardian is submitting an exemption form, we always look on the bottom left side of the form. It must say 2025. Any prior year forms will not be accepted. We do ask that schools and providers refer to our website to obtain the most current copy of the form. Please do not print stacks of forms and hand them out to parents, as if the form has changed and that form that you handed out is then outdated, we don't want to put the parent or guardian in that situation either. So please just always refer them to the website for the current form. We do also have new forms for our NMSIIS user agreement and NMSIIS organizational agreement. These are the forms where a user or a provider or clinic would onboard to NMSIIS. This is usually done after the user has taken the training, and those are updated every year, so that is nothing new. Now, here's a couple of topics of what's next for NMSIIS. The first is data modernization. We all know that, especially recently, funding has been less secure, staff and resources are less sure, and so we want to make sure that our data and our systems are being automated, that our data can be linked, that we are staying as relevant and on top of data modernization as possible. And this is an across the country type of initiative. And so NMSIIS is trying to maintain these standards as the federal entities such as the CDC puts out for us. The IZ Gateway expansion, we looked at the map for the IZ Gateway. New Mexico is willing to partner with any of the states that are willing to partner with us. Unfortunately, right now, we are just waiting for other states to onboard to the IZ Gateway, and then we can further that expansion. We are working on improving our data exchange communications. We have begun sending out quarterly newsletters to our data exchange providers and EHR vendors. This is an attempt to just improve communication, get those communication lines open, and try to ensure that Marlene has as much support to further data exchange for our providers as possible. Now, the next two are not in place yet, but they are efforts that we are currently working on for NMSIIS. The first one is a non-compliance notification process. And what this would mean is if ABC Pediatrics is a data exchange provider, but we have not received data from them in X number of days, we would receive a notification and we could then reach out to them and say, have you not been vaccinating, or is there a connectivity issue, or what can we do to get this back on track? But it's basically an additional monitoring system to help us and our kind of limited staff and resources to make sure that we're providing the best service possible. We're also looking into creating provider report cards. And what this would do is create a summary page for the providers, and it would show the last time you ordered, how many doses you ordered, what types of vaccines, when you last did a reconciliation, what your wastage looks like, what your data reporting looks like, your staff changes, primaries, backups, things like that. Put it all in a snapshot for us. We are again hoping that this will allow providers and users to better track their own clinics and providers, and allow our programs to monitor as well. I mentioned earlier that we're looking at auto-decrementing for data exchange providers. We have put that off for several years, so that is something that we're looking at for this coming year. We're also interested in implementing a help desk chat feature. For those of you that remember, like instant messaging from AOL or times like that, this would be an opportunity for a provider, instead of calling our help desk and waiting on hold for an agent, they would be able to just send us a quick message and say, I'm locked out of my account, or what's the status of my vaccine order, or anything like that. And we could then respond similarly and hopefully much quicker, and it would be documented for the provider. And then the last kind of project that we're looking at is a potential required training for parents and guardians before submitting a vaccine exemption. We just went through quite a bit of data on how exemptions are on the rise, and we need to look at how we can deter parents from obtaining an exemption and improve vaccination coverage rates. The idea for this would be that the parent or guardian has to complete an online vaccine training on infectious diseases and the importance of vaccines before they could then submit their exemption. Unfortunately, implementing a project like this does have to go for approval in several levels, all the way up to the governor's office. And so it does take some doing, but it is on our to-do list, and we're hopeful that it will be approved. We've seen other states do this very successfully, and we feel like this might help us improve our exemption rates. For those that need access to NMSIIS, you can go to the Train New Mexico website here. There are two types of NMSIIS training, so you would just search under courses NMSIIS and the two types will come up. The first one is a new user course, which is reader report only, and that's exactly what it sounds like. You can view the system, but you can't make any changes to it. And the second would be a basic standard user course, and this is someone who could edit NMSIIS, who could edit patient or vaccination information, who could run reports, who could edit inventory, all of those types of things. So you would take the training based on the type of access you need, and then send the completed training certificate and the completed NMSIIS user agreement, which pops up after the training, to our NMSIIS.access@doh.nm.gov email address, and we'll go ahead and get those credentials out to you. Please keep in mind that it is not allowable to share credentials. Every NMSIIS user must have their own access. As I mentioned earlier, we have lots of materials, promotional materials, marketing materials. These ones on the left are specific to our vaccine public portal, VaxView. It outlines the process. There's a QR code that takes you directly to the website. And it also gives you a couple of resources, including our help desk and our NMSIIS access email for those that are unsuccessfully searching in the portal. On the right-hand side, we have some school entry requirements in both English and Spanish for both kindergarten and 7th grade. These came up as a request earlier this year during the statewide training, and these basically outline the process. So these are the school requirements for vaccines. If you're not going to get a vaccine, here's the exemption process. If you're not going to get an exemption, you are subject to disenrollment from school. And so we had heard from our school nurses and school administrators that they needed a little bit more kind of visual backup to be able to show the parents and guardians, and these were then created. If you are interested in having any of these promotional materials sent to you, please just send me an email and we can get them mailed out. Here's some support from our team. We've got our help desk, as I mentioned. It is open from 8 to 5, Monday through Friday, closed during lunch. We do have multiple agents on at all times, so we work really hard to keep the queue times very low. We've also got a NMSIIS email address, and it says NMSIIS.access, but please don't let the access deter you. It is not just for access. If you have a data quality issue, or a report issue, or a question about access, or a question about our VFC program, or anything, send us an email and we will do our best to either answer it or get you over to the right person. I've also got my own information here. Catherine Katie Cruz, got my email and my phone number. And then on the right side, we have our website and we have our NMSIIS site. Overall, we appreciate all the work that all of you do for the state of New Mexico and your work in making sure that NMSIIS is the best, most accurate, usable data possible. Thank you all very much.